Great to have you along on this Thursday evening. Special guest in studio, Dr. Stephen Mulholland. He is the founder of SpaMedica, one of Canada's top cosmetic surgeons. And he's taking your calls and answering all of your questions on anything related to any procedure you might be thinking about having. Maybe it's something sort of on your wish list. You're not sure if you can afford it, or maybe what's right for you in terms of a spot that is bothering you. And we're answering any kind of question, I guess, people would come to see you for a consultation about,
sure,
right?
Anything from non-surgical to surgical. Weight loss is a good entree into where does liposuction fit, and do we have some non-liposuction technology? We've got some really cool stuff. There's a new technology that for the first time works from the inside out. So it's pulsed high-intensity electromagnetic radiation that results in contraction of your abdominal muscles or your butt muscle or your thigh muscle. And it's like 20,000 supramaximal contractions in 30 minutes. You can't ever replicate that through exercise. And it creates about a 20% hypertrophy in your muscle fiber size and number of your abs or your glutes or your thigh after simply 4 treatments in 2 weeks. And it kills about 18% of the fat over top of that. So that's totally new. We've had cool sculpting, we've had sculpture, we've had all these products. This is very, very new to the North American market.
So this is like fat reduction plus a workout?
Correct, yeah. So you're building tone, you're building up muscle, and you're killing the overlying fat. Emsculpt is its name. There's going to be a lot of spillover from media in the U.S. and in Canada. It's very, very safe. There's almost no contraindications. There's no thermal heat. It's very comfortable. You get kind of like that lactic acid feeling 2 days later, like you had a really good workout. But that's been very, very popular. Now, you can't be particularly chubby or overweight, so it's not for your bigger BMI patients. They need weight loss, cool sculpting, sculpture. It's for your smaller BMI patients, like a BMI of 28 to 30, couple of inches over, or your rectus abdominis or your muscle, or, a butt that's a bit saggy and you want to tighten up the muscle and lift the fat. That's who it's good for. So for the very first time, we can now treat from the inside out, from the muscle out to the fat, rather than from the outside in.
Now, I know that when your wife was doing the show and you were on it, and I loved it. I watched it every week. And there was one episode where a number of the housewives took part in a demonstration, and they had something attached to their abdomens.
Yes.
Was that one of these?
That is one of the outside-in products, and that was new then. It shows you how quickly our industry changes. That's called sculpture, and that's sustained heat that will heat the fat for 25 minutes and kill a significant percent. Or we can do cool sculpting, which cools the fat from the outside. Those are what I call the outside-in technologies for fat reduction, but they don't affect your muscle at all. This product puts 2 electromagnetic field paddles over your rectus abdominis, and you get titanic supramaximal contractions. They feel odd. They feel weird. It's not like physiotherapy EMS. These are like, as I say, 20,000 in 30 minutes. You can't replicate them so we get even fairly sculpted bodybuilders come in to get that 20% more muscle fiber they can't get in a gym, and kill whatever fat they have over their muscles. So for that type of patient that's pretty fit, has a little annoying pot after all the workouts, it's a nice way to rehab, enhance, and build your muscle while killing fat.
And 30-minute treatments, and how many treatments do most people need? It's
really just 4 treatments over 2 weeks, and you wait 4 weeks.
Wow.
And it's very quick. Most of our treatments take a long time, other than Botox and injectables, like a package of hair removal, a package of photofacial. This works very, very quickly. Some patients will come back and do another 2-week cycle, but the basic program, where there's well over 90% satisfaction, is just 4 treatments over 2 weeks.
And what kind of difference do people see? I mean, I know you've talked in percentages. Is there a measure in terms of inches?
In general, it's about a centimeter reduction of pinchable fat, and a visible toning and honing of your muscles. So you're killing some of the fat over the muscle. You can see more of your muscle, and the muscles themselves look more toned, more defined, more polished, like you have just finished a 16-week or 4-month bodybuilding cycle to build up your pecs, your arms. Yeah, it's super amazing. This 20,000 contractions in 30 minutes would take you months to replicate. You can't even do that if you're a bodybuilder. So we have many guys who come and say, wow, I've been bodybuilding for 2 years. I can't do this on my own. So it doesn't replace exercise or diet. It's when you've got to a stalled position in your body shaping goals where Emsculpt takes over.
416-872-1010. Text us at 71010. If you have any questions about any cosmetic procedures you are curious about, maybe you have been thinking about for yourself, or maybe one of your kids or your spouse has come to you and said, I'm thinking about having this done. 416-872-1010. Dr. Stephen Mulholland is here for the hour, and you are listening to The Night Side.